Hi everyone, Jessie here. Today I am very honored to be talking to Dragana Skokovic to talk all about probiotics. This is a hot topic for anybody with gut symptoms. So Dragana is a clinical pharmacist practicing in primary care settings. She is also the author and a collaborator for the probiotics charts in the US and also Canada. Hi Dragana. Thank you.
Hey there.
Joining.
This is great. Thank you for inviting me.
You put together a guide for clinicians so that we have somewhere to look to whenever we need to make sure something we are recommending or something that people are asking us actually have evidence to it. So thank you so much for joining us.
Well, thank you for inviting me. And as you mentioned, I'm a clinical pharmacist. I'm a primary care practitioner. I do see patients in the clinics in a general practice or family medicine clinics, and I do understand what kind of questions patients have and also what kind of questions and confusion my colleagues are facing when trying to navigate this field. So I completely understand the interest in this topic because it's really popular topic. It's very confusing. There's really difficult to find clear answers. And we are bombarded with information and marketing.
Yes.
So I would like to kind of ask questions, but you mentioned the two guides that we've been involved in preparing and reviewing and annually updating. This project started in 2008, so a long time ago. This is why we are in a 15th edition in Canada. So this is Canadian Guide, English and French version. And it's the 15th edition, which is, as I mentioned, annually updated, and it's 9th edition in US. So we have started in US in 2015. So what we do, we look at the research, what is published, and look at the research that is relevant to our patients. Mm-hmm. So that means that researchers have used a probiotic as intervention that was clearly defined, the strain defined, the format defined, and they measured the evidence and a clinical outcome. You were asking me a question. Go ahead.
Yes. Well, before we jump into the guide, can you tell us what probiotics are and why it is important for us? Let's start with the basics, because I think most people here don't have that clinical background.
Absolutely. Absolutely. And, with the basics, the word probiotic is very popular. And you will probably find probiotics in many things that you reach for, starting from skincare to supplements to foods, etc. But the word probiotic is defined by authorities, by consensus statements. So probiotic is something that is live bacteria, that is, when ingested in adequate amounts, provides a health benefit to us. So it has to be live, adequate amount, and health benefit that is proven. So not many products that carry a label of probiotic are actually probiotics. There's also confusion that we have probiotics in our gut. No, we don't. We have microbes in our gut that are friendly to us, commensal to us, but probiotics we have temporarily. When we take probiotic, it goes through the gut and gets out. So those are kind of confusion that are very common.
Yes. Thank you for clarifying that. I think most people don't understand the difference between probiotics that we're taking in and microbes that are sitting in our guts. They are the people, our long-term tenants, right? Let's put it that way. And then when we take the probiotics, do some of them get to stay in our guts? Do they alter our gut microbiome to some extent?
So there's also popular belief that probiotics colonize the gut or they stay in the gut, which is not true. They are, for most of the adult population, probiotics will be friendly visitors that will support our own commensal microbiome, make it happier, make it thrive, and regain the strength and diversity, and then they will disappear and leave. However, in very young and newborn babies, the gut is actually getting colonized in the first couple of years of life. So, they're picking up microbes from environment, from mother, caregiver, breast milk, etc. So giving them probiotics, those probiotics might stay in their gut longer. So that's kind of where research is going as well.
Right. And we I want to just caution everybody, we don't really have much data, so don't trial it with your kids unless specified by your doctor.
That's correct.
Yes. Well, now, thank you so much for giving us the background. So before the 3 years of life, right, that's when we're thinking when things start to settle, when we have the structure to support what our typical gut microbes will be, and moving forward, it is very hard to change it. So the first 3 years of life or first 2 years of life is extremely important when we have research looking into it. Well, now we've gotten the foundations, the basics. Let's talk about probiotics and the probiotics charts. And I want to give everyone a quick background. This is a clinical guide for the people who are just joining us now. This is a clinical guide for clinicians to look at what evidence there are for certain strains of probiotics, certain brands, for what condition and symptoms they support. So it is a very important tool, especially for people who work in the gut health industry. Well, gut health setting. It's very important too for us because there are so many products out there. And now I want to ask Dragana, how do you define what product works and what products don't work? What research do you look at? Where do they come from? Where do the research come from? And how do you analyze them for effectiveness?
Mm. So thank you. And again, this is something that, as I mentioned, we've been working on for a long, long time. So research has to be published, has to be recorded someplace. We quite often would put higher rating for the research which is published in peer-reviewed journals, that is randomized, well-designed trials. And as I mentioned earlier, where the study researchers or investigators clearly defined clinical outcome. That means that this particular probiotic administration will have a meaningful effect for a patient, meaning it will relieve the symptoms they're suffering, it will improve health in a measurable way. So those studies and those products are included in the guide.
Okay, great. And within those studies, how do you analyze the effectiveness and safety for each one, or look at how well the study was conducted? Let's put it that way, because there are so many studies out there, right? How do you evaluate them?
So again, there's a process of evaluation, looking at the bias, looking at the, recruitment criteria, whether it's registered with the clinicaltrials.gov, where it was published, etc. So there are many factors that we take into consideration. It will be too long to go over to all the details. Right. But again, we do accept, we kind of almost approach the meta-analysis approach to evaluating a product. So see all the studies done with the product. Basically, that means a strain in a specific format before we actually include it in the guide. The reason why we do that is sometimes same strains or combination of strains in different formats will not provide same benefit. So that's why we look at all the details of the study before we include the product in the guides.
I love that. Can we talk a little bit about this? Because there is a lot of confusion about single strain and multi-strain. A lot of providers out there say you have to take a multi-strain, but what is the difference right now? What evidence do we have between single strain and multi-strain?
So there are lots of products with single strains, some with a combination of 2, 3, up to 14 strains that are included in the guide. What it means that those products in that set combination have provided proven benefits to a patient. However, what's happening on the market is that, for example, a company will pick one probiotic strain that has good evidence, lots of studies, and they will add few more strains or many more strains in hopes that will differentiate their product from others, that will make their product unique, hoping that this will give better effect to the patient. But if there's no proof of any kind, we cannot assume that. Because what we know that sometimes those probiotic strains will actually compete with each other for food, for replication in the gut, for staying alive in the gut. So they might effectively kill the good bacteria, the good strain that we are giving, and not provide any benefits. So unless we have a proof, we cannot assume that some new imaginative probiotic combination is better, and not always more the merrier applies to probiotics.
Right. And if it's okay, I would love to jump in and say that, because as a clinician, I guess you see it all the time when people are taking random strains or multiple strains of probiotics. It doesn't give them symptom relief, and it can often make their bloating worse and sometimes send them to have straight diarrhea. So as clinicians, we see that all the time, and people would buy things on the market that may not be the most suitable for them.
Yeah.
Thank you for clarifying that. And I'm assuming here most research are done on single strain. So that's why in the guide we have more of the single strain products that are recommended versus multi-strain products. And also summarizing a little bit of what you were saying earlier, some companies take those single strain research, combine them to differentiate with other products and try to promote their product as more superior, when in fact, we don't have the research to back it up and say that they are actually better than single strain. So we want to caution people away from just looking at the marketing guide, right? Just looking at the marketing, because we are bombarded with messages everywhere. And even on social media platforms like Instagram, I see influencers promoting probiotics. I see doctors promoting probiotics. I see dietitians promoting probiotics. It's very confusing. What would you recommend to a consumer when they are seeing these marketing ads? What should they do?
So first of all, it's looking at making sure that there is a strain designation on the label. That's number one. Mm-hmm. If the product does not state a strain, and we keep saying about strain, but let me just go back to explain what a strain is. Each probiotic has a name that has 3 parts. Let's say lactobacillus, and then second one is, let's say, reuteri, which is still not telling us what that probiotic is. The last part, which is usually a confusing series of numbers and letters, is the strain. So that's the kind of a social insurance number for this particular person. So not first and last name, because there are many John Smiths, but there's John Smith with this social insurance number. We know exactly who that person is. So this is what we need to see, the strain on the label. Caution is because companies that do not list the strains kind of reserve the right to change the strain if the strain they're using is not available or it gets more expensive. They'll use another John Smith instead of the original John Smith without having to actually state they have made a change. So that's why before evaluating any product, make sure that strain is listed. And then, check whether there's any research with that strain, check whether it's listed in the guide. What we also suggest to patients is talk with your physician, talk with your dietitian, pharmacist. Make sure that probiotic as a choice of therapy is good for you to try, because some conditions you do not use probiotics, you cannot use probiotics, you don't know whether they'll be working or making things worse. So if you are given a green light, you can try probiotics, then you can then do the research and see which one you would like to try.
Mm-hmm. And when you're talking about doing the research, we are referring to going to the probiotics charts, right? And the website for the probiotics charts is www.usprobioticguide.com. There you'll find evidence-based recommendations for adults and children and for specific conditions. It's very important to match your condition to the right strain of probiotics. And I love how you talked about the first name, last name, and then the reference or the social security number, what we call it a little bit differently here, to recognize a strain. There's not just the lactobacillus or not just lactobacillus reuteri or lactobacillus rhamnosus. We also, well, that's one strain that I recommend all the time is lactobacillus rhamnosus GG, because that one really helps with preventing antibiotic induced diarrhea. It also helps with IBS constipation. So that's one strain that I recommend all the time. And we want to make sure the probiotics you're taking contains that strain, and probably that strain alone, because LGG is well studied, but there are many lactobacillus rhamnosus out there. It may not always be GG.
That's correct. That's correct.
Yeah.
You know, what I like to say sometimes when I try to explain to my patients, because this whole concept is very complicated for them. And, you know, in our primary care practice in Canada, we've been kind of asking patients, you know, and we are so surprised that a huge majority is taking probiotics. They have no idea why, and they have no idea what they're taking. So that's, I think, huge potential waste of resources. Those patients maybe could invest their money into better food and diet to feed the good bacteria better, rather than taking a probiotic that there's no evidence for. So sometimes when I try to explain to them, I use the kind of analogy to, you know, if your faucet is broken in your house, you don't know how to fix it, you're going to call your plumber, and you'll know your plumber by name, and you have his phone number. So this will be your strain. That means that he will come and fix it for you, or he might bring his apprentice or somebody to help him to fix it. You do not call me or your grandma or all your friends to come and fix it. You know, more the merrier. And the plumber, because first of all, we have no idea how to fix it, and if there's a full house of people, he might be having more difficult time fixing your faucet. So this is why really being specific, targeting the effect of probiotics, this is where the future should go. This is our patients should be doing. Again, improving outcomes, saving money.
Right, exactly. That's a really good point, because oftentimes probiotics are very, very expensive. It's only getting worse, especially when you look at online how expensive everything are with probiotics, or ones that have a lot of marketing budget. They seem like they are very legit, but then are they really legit? We don't know. So go check the guide. And if you are a clinician, you know, this is a tool available for us. Before we make any recommendations, we should always check it to make sure our recommendation is still up to date. Yes, and if anyone have any questions, drop it in the chat for us. What questions do you have on probiotics?
One of the questions I noticed when you were promoting this event was about gut testing.
Oh, gut GI mapping.
That's correct.
Yes, I had that question yesterday. So that is gut microbiome testing, and there is a lot of noise in that area. But what evidence do we have? Is that something you would like to talk about?
So
I would love to learn
just
more
to address
from you.
that, because we have been educating on that as well. Trying to figure out what's going on in our guts is been going, a challenge for a long time. In the last decades, we have had lots of different projects worldwide looking at what is in the gut, whether there are differences in age, differences in geographic setting, etc. So this is all for research purposes. However, the next step to, at home gut testing or gut mapping, it's not time for not prime time yet. We still, if you can test it, we don't know what to do with the results. We don't know what is your own unique standard of balance, or whatever that should be, whatever we should be finding. It's not like doing a blood test for your B12 levels and you're lower than standard expected, so you should take some B12 supplements. It does not work for probiotics. These tests are extremely expensive. They vary in accuracy depending how you collect the sample, how you store the sample, how you send the sample, what kind of analysis they use, and then with the findings, it's kind of interesting information, but we have no idea what to do with it. So this is why we suggest to patients, do not waste your time and money on those yet. We might come to the time that will be a common practice, but not yet.
Right. Thank you for clarifying that. And that's a question we get all the time as clinicians too. Do we do the stool test? Or sometimes I see patients who bring me their results and I tell them, you know what, these are not legitimate, and they've spent hundreds of dollars, if not thousands of dollars on those tests. And oftentimes those tests, in the practice I see, those tests are used for the clinician that orders those tests to sell supplements, to sell protocols. And oftentimes it can be more harmful for the patient. And of course, it's a lot of money.
Yeah. On the other hand, we have the stool testing for, to address your risk of colon cancer. That's a legitimate test. We have a stool test for calprotectin, for the inflammatory bowel disease. So there are some legitimate stool testing, but at home mapping of your microbiome, not yet. Don't do it yet.
Right. Don't do it yet. We don't have a good technology that produces consistent results. We don't have a full knowledge of what our gut microbes look like, and probably you probably have to I'll have you weigh on this. People in different geographic location or different diets, they will have different gut microbiome, and we don't know what is best, what is better, and there's no way to change it. These kind of tests will not give us that kind of detail, and our research and our data on it is still very limited at this time.
Correct.
Okay, perfect. I can pull up questions now. I have the question here. So probiotic and yogurt/fermented food make my motility disorder much worse, to the point even laxatives don't work.
So this is interesting. Fermented foods are part of the balanced diet for people that can tolerate them. Fermented foods are prepared or made by using different kinds of microbes or yeast to change the consistency and metabolic status of ingredients in a food. So basically, they are food altered by microbes for us to ingest them and digest them easier. They do not necessarily still contain live microbes by the time we ingest them. So those are not always probiotics by definition. Finding out what makes your symptoms worse and eliminating, of course, is something you do work with your dietitian or on your own. And if there is desired effect to regulate motility, if it's to work for constipation or for diarrhea, then you select maybe a probiotic that has evidence for it, or work with dietitian looking at the dietary interventions, maybe over-the-counter medication with your pharmacist. So there are multi-step approach for these things. But fermented foods are not for everybody. Not everybody likes the taste, can digest them properly, and sometimes they do cause problems.
Mm-hmm. Yes, and I'll weigh in on it a little bit as well, because when this person sounds like she would need, or he or she would need laxative. So there's a slower gut motility. When people have slower gut motility, the foods or the probiotics may stay in your gut for a little bit longer, causing more bloating, more symptoms. So it can make symptoms worse. So eat fermented foods to your tolerance. If you ask me, I would recommend maybe start with a very small dose and then increase it slowly every day to see what your tolerance level is. Don't just load your system with a lot of fermented food all of a sudden when your body is not used to it, because it can take time. It may change. Your tolerance may change if you let it go slowly and see how you tolerate it. Okay, but that is a really good question. And with fermented food, we always want to be careful and go slowly. Let me see what other questions we have. There is one question here, and I kind of shared the answer already. Somebody asked, what about taking probiotics after antibiotics?
So with the probiotics, we do recommend them routinely along with the antibiotics, because we do know that antibiotics, even in a single dose and a low dose, will actually alter the diversity of your gut microbiome. So specific probiotics will actually help support your diversity and in some cases even make your antibiotic work better. That will be, the research is really very active in looking at how probiotics can actually augment the effect of antibiotics at the mucosal site, which is very encouraging. Again, not all probiotics, specific probiotics. But the question always was about the administration and timing. We usually suggest to start at the same time you start antibiotics. If you know that if you're anticipating starting antibiotics for dental procedure or something, maybe you can start probiotics even a couple of days earlier. But if you have infection or something, it's kind of sudden onset, you have to start antibiotics today, you might start probiotic the same day. And then continue probiotics for 2 weeks after you finish antibiotics to make sure there's no side effects of antibiotics such as diarrhea, vaginal yeast infection, etc. The timing is always a question, but we don't know. That's the answer. The empirical suggestion is to separate the administration by 2 hours, but this is not based in a hard science. It's just what we tell patients because we do not know differently. We might be changing this as the time is progressing, as we are getting more and more studies. We might even change it to take it the same time as a antibiotic. So that's something like you stay tuned for that. We don't know yet.
Yes, great. Thank you for clarifying that. I always say 1 hour, but now I know better, 2 hours after antibiotics, because sometimes that can be tricky if they take it at the end of the day. Okay, and then we have another question here. Does probiotics exaggerate IBS symptoms, or will it help? I think that again, yeah.
That's a great question. I would suggest from our experience, the probiotics listed in a guide, most of them will actually help with the IBS symptoms. Some will work faster, some will take a little bit longer. Some contains dairy products, so they cannot be used for patients with the lactose intolerance. Some are in a yogurt form, some are in a juice form. So it depends what your tolerability preference is. But we have different kinds of options of probiotics listed in the guide. So I would suggest you explore that. However, we also have reports that we have filed and published with probiotics that are either non-defined or multi-strain probiotics causing digestive issues and symptoms. Fairly recently, I had a patient that was diabetic patients with no digestive issues, but when she started probiotic that kids purchased for her to improve her health, she developed fecal incontinence. And she was not connecting it with that probiotic. Her sugar went up because she was not walking or exercising. She discontinued her medication for diabetes, thinking that they are causing the issue. When we saw her and we suggested that she stop that probiotic in anticipation that a few weeks after we'll start a proven probiotic for her issue, the whole problem resolved. So she told us she'll never ever try any probiotics in the future. So she is not completely against it. But this is something that we have found that, just picking something off shelf with a multi-strain, might cause a problem. Yes.
Yes. And this is actually something I see all the time. A lot of the times people have mild bloating, mild constipation. Yes, it's uncomfortable. And then they are recommended by friends, family, or the internet to say, take this probiotic, take that probiotics. And then they end up having a lot of diarrhea. And it hits pretty quickly too, but oftentimes people don't associate it with the probiotics they're taking. But sometimes it could be the probiotics they're taking. And a lot of my clients, once I tell them to stop the probiotics, their diarrhea stops, or it becomes better, more forms, instead of just runny diarrhea 10 to 12 times a day, sometimes even. So be very careful. Always reference the guide, and I'm going to give you the guide's website again. Is usprobioticguide.com. Or if you Google probiotics chart US or probiotics charts Canada, you will find the website. Let me see what other questions we have. And on the guide, I'm just scrolling through as you were talking. A lot of the products on there that is included in the guide are for IBS. I know some people have questions about IBD as well. There are some recommendations for IBD too, and especially ulcerative colitis and pouchitis. So there are recommendations on the guide. So make sure you check them before you take anything. And if your doctor or healthcare provider recommend the probiotics, make sure to ask them to specify which strain they want you to take and what brand they want you to take and how long to take it for.
Yeah. While you're checking the questions, I just want to tell you something else. The data published in the guide in print is also available on the website, but in a mobile app. There is a mobile app if that's easier. Both online versions, the website and mobile app, contain same information. You can search by indication. You can also look up the evidence or resources that we have posted and why we assigned the indication. The mobile app is called Probiotic Guide, not really imaginative, but when you find them in your app store, there is one for Canada and one for US, so choose one for your region.
That is wonderful. We always want things on our phone nowadays, and that's going to be extremely convenient. I always go to the websites just in case you updated it, but now I have the app. Okay, I had a question that I think is really good. If the probiotic guide recommends Yakult and Activia, should I try both at the same time?
I would say the short answer is no. If your faucet is broken, you don't call two different plumbers. They'll get into fight, saying who can fix it faster and better and whatever, cheaper. So take one or the other, or one and another if the first one did not resolve it. So because we don't have the evidence that those two together will actually work well. They might compete with each other and not provide any benefits. So basically, we go against that kind of, let me just take one for migraine, one for vaginal yeast infection, one for my IBS, and one for, something else. So no, don't do that.
Right. And as something I was saying earlier, start at a small dose and slowly increase it to see what your tolerance level is at. Anytime when it comes to probiotics or even fermented foods, some people may not tolerate it, especially if you have gut motility issues. So start small, slowly increase, and see what your tolerance level is at. And we actually had a multiple question about SIBO. I know there's just not a whole lot of evidence out there when it comes to SIBO. Will you share with us what you know so far about probiotics and SIBO? And SIBO stands for small intestine bacteria overgrowth. It's a condition that is closely related to IBS, but not everyone with IBS has SIBO, just FYI. Okay.
So there's lots of research. Again, we do not have a clear-cut answer for probiotic use in SIBO. In some patients, probiotics will actually make symptoms worse. So basically what happens with SIBO, it's bacteria that is living in the lower intestine, starts going up in upper intestine in areas that should be more acidic, but they are not. So then this bacteria that is good in the lower parts of our intestine starts kind of having party and starts spilling, kids are in the basement having party, but then those teenagers come upstairs and they're in your bedroom. So that's a mess. So this is, we like to keep the bacteria lower where they actually will be beneficial. So one of the things is multiple approach again to SIBO, definitely antibiotics, specific antibiotics are the best golden standard therapy at this point, but also looking at things like, using and overusing the acid suppressors, such as proton pump inhibitors. They are, I think, overprescribed. Globally, North America specifically, we have the deprescribing movement with the Choosing Wisely Canada to take people off the PPIs, proton pump inhibitors, if they're not necessary. Because people usually start with them when they have a bleeding ulcer or some, severe issue, and then stay on it for years and years, causing the problem. Because when you suppress acid in the stomach, then you change the pH levels, acidity on intestine, and then bacteria starts coming up. So long answer to a short question, probiotics in SIBO, we don't know yet. We cannot make recommendations yet.
Right. Thank you for that. What about probiotics after treating SIBO? I suppose that is still, we don't know yet, right? Because right now the research is quite inconclusive. There are a lot of research going on, and somebody asked about antibiotics. Yes, that's one of the ones that is studied to help with SIBO, but of course there are different types of SIBO as well. So make sure you talk to your doctor so that they know which type of SIBO they're treating and they can get you on the right antibiotics.
That's correct.
Okay.
That's correct.
Yeah. We've shared a lot today. I want to say thank you to Dragana, and also thank you everybody for joining us. Will you give us a closing remark about probiotics? What we want to be careful of? What do we need to do before taking one?
So again, being very critical. First of all, stepping back, think about, when you are needing intervention. If it's medication, you're going to be very careful what you're going to take and for how long you're going to seek advice. Same approach to probiotic. Not everybody has to take probiotic. And if you are supporting your gut with a good food and food for bacteria in the gut, that's great. That's why you need a dietitian. But for probiotics, be definitely very critical. Look at the small print, check the guide, and ask and speak with your provider, whoever that is. And then for the probiotics, most of them they don't need to be taken all the time. It's definitely until symptoms are resolved, and you might be okay discontinuing them and taking them only when needed after. So definitely seek the guidance. And again, remember, not everybody needs to take it. I also like to say that with the AEProbio, or the Alliance for Education on Probiotics, is a nonprofit organization that has lots of great researchers on board, and follow AEProbio on Instagram or any social media, because they do post lots of great information. There's a great handout for patients on IBS, for example, and it's updated annually. At the back of that handout, there's actually a list of products that are available in your region for treating the IBS, for example. So check that at aeprobio.com on the web, or just AEProbio at the social media platforms.
Right. So follow the account AEProbio on social media, or go to aeprobio.com, where they have education on probiotics and picking the right string. And I want to piggyback on what you just said, to be very careful, because in the past, I think we used to think that probiotics may be benign, but now with more research, we know that it is not always benign. Be very careful what you put in your body. Don't believe in the marketing. Always talk to your healthcare provider. And thank you for spending the time with us today, educating us on such an exciting topic. We still have so much to learn. And hopefully we can bring you back again sometime in the future when we have more data and maybe more guidance on how to use probiotics, because I'm sure it's going to change with all of these research coming in and you guys analyzing it. Yeah.
Absolutely. Thank you for inviting me to join this. And again, also great questions. And I hope we wish we had more time to talk, but there is definitely follow the research, follow Jessie. She is amazing to keep everybody up to date.
Well, thank you, Dragana. Do you actually, I forgot to ask you, do you have any questions that you want to address before we go? Can you pull up the question box as well?
So I'm just going to check right now. The organization to follow, we just mentioned the AEProbio, which stands for Alliance for Education on Probiotic. There's lots of questions about the Zoom consultations. Unfortunately, I do not offer those. I think Jessie does, and she's very knowledgeable. And I do work, as I say, in primary care, but in Hamilton, and I see patients with my clinics only. Just looking if there's anything IBS related. Okay, that was a SIBO question that we already said. Probiotics to take down the bloating. Bloating, as I say, one of the most prevalent symptoms of IBS. I don't like to recommend products, but I can tell you that there are few strains that I like to use a lot because they provide very quick relief. You mentioned one of them, Lactobacillus rhamnosus GG. Also, Lactobacillus plantarum 299V is one of my favorites because, again, patients do experience bloating relief within 7 days of taking it. There's also bifidobacteria, that's lactis. I cannot remember the names, like with a series of 5 numbers. That is very popular, sold under the same brand name in Canada and US. That one is also a favorite of our patients. But again, that, as I say, I mentioned, check the guide and see what's listed, because I do not like to recommend brands. I'm not associated with anybody, so I'm not doing that. There's a question about the women develop IBS later in life when in menopause and postmenopause. There's quite often, sometimes IBS can get worse, especially if there's a bit of endometriosis, which is endometrial tissue outside of endometrium, which then can start leaving a scar tissue and pulling on a gut, causing more of the symptoms. So yeah, that sometimes can get worse in menopause. I believe we have answered most of them.
Yes. Yes, and there is one that popped into the question box, and somebody was asking, where do you recommend the testing? And we want to say it again, we do not recommend gut microbiome testing. We don't have the technology or the data to interpret the results at this time.
That's correct.
Yeah.
There was also a question about the chart and what types of IBS. There is definitely, we try to type your IBS based on your symptoms, whether it's diarrhea predominant, constipation, or mixed, or alternating. In a guide, we did not specify. So I would encourage you maybe to just check the references for each product and see which ones, what was the actual outcome in each study. Or if that's too complicated, speak with Jessie, speak with your dietitian, speak with your pharmacist, and they'll help you maybe navigate and pinpoint which one of the probiotics would be actually better for you to try. And one other thing, last thing with the guide, there is a products, each indication has a level of evidence, a level of recommendation. Level 1 is the highest, level 3 is the lowest. We list them all and you decide, we usually starting with the best level of evidence, which is number 1.
Yes, that's something I love about the guide, because there is a lot of product out there and their evidence, looking at the strength of the evidence can really help you determine where to start, and start with level 1. If you don't remember this, just go to the footnotes of the website or on the app so you know which one means what. And shamelessly plugging our program that is coming. We are launching the IBS Freedom Program on Wednesday. It's a very low cost, self-paced module workbook program where you will learn about your type of IBS, where I walk you through how to identify different types of IBS. So once you know your type of IBS, you can trial some of the probiotics that is on the guide. This is usually something your doctors would do with you to identify what type of IBS you have and create a treatment plan. But sometimes it doesn't always happen because they only have 15 minutes with you. Once they diagnose you with IBS, usually you're like, okay, go try this, go try that. But in the low-cost affordable program, it's only going to be $18 a month. And you have access to the modules, to the videos to really learn about IBS and create an action plan for yourself. And then once you know the different types, the type of IBS you have, you can go onto the guide and look at which specific one is recommended for your type of IBS. Again, it is really important to match your symptoms, aka your type of IBS, to the right strain that actually helps you, so that we are not making things worse. And of course, we are addressing the right issue here.
That's great. And there was a question
Yes.
about this live will be recorded and posted later, I guess? Yes, perfect.
Yes, I'll post it, and I'm going to tag Dragana and also AEProbio on there so you can go and follow them and hear more about the latest research. Actually, Dragana, you have a webinar. AEProbio has a webinar coming up on Wednesday that I'm very interested in. Do you want to share a little bit about that?
So yes, that's correct. On Wednesday, we have lots of questions about probiotics and potential role in COVID, because we do know that certain probiotic strains can actually minimize risk of getting colds and flus. Those are listed in the guide as a common infectious disease prevention or treatment. Lots of research was done with using different kinds of probiotics for different stages of COVID, whether it's prevention or minimizing risk of complications and hospitalization, or preventing long COVID, or working to minimize the long COVID digestive symptoms. Confusing, very confusing. So what we decided to ask the experts and get them all on a panel discussion online. So this is happening on Wednesday at 12 noon Eastern Standard Time. And they will have Dr. Gregor Reed, Dr. John Damianos, Dr. Jordi Espelermazo, Dr. Paul Wischmeyer, Dr. Peter Lin. So they will be talking about their own research. And we will be answering lots of questions to figure out where we are, what we know so far, and where we go now. From there, this will be not recommending specific probiotics for COVID. We are not there yet, but again, we might get some insight on the role of microbiome, and probiotics in the future.
That will be great. And I know millions of Americans, and probably in Canada as well, are struggling with long COVID. Hopefully they can address some of that as well. And I'm definitely looking forward to it. And again, Dragana, thank you so much for joining me today and sharing everything about probiotics and IBS, and also gut microbiome tests. We do not recommend it. One last time, I know that was a hot topic everybody wanted to know. Thank you so much. And thank you everyone for joining us.
Thank you.